Thank you, Mr. Speaker. Mr. Speaker, the Minister of Health indicated that there are basically 61.7 thousand New Brunswickers without permanent family doctors in this province. Now, the throne speech said that this government was going to work to reduce the number of doctors working in solo practices. This has been a commitment by government after government after government, going back to, I think, Bernard Lord, through Brian Gallant, to this government, and nothing has ever come of it. Mr. Speaker, the solution that we need has to be concrete and practical, and that is to ensure that nurse practitioners, registered nurses, and other allied health professionals are paid to work alongside doctors in their practices. That's a key part of this solution. So can the Minister of Health tell me why he is not providing funding to ensure that those collaborative healthcare practices can occur?
Thank you. Minister of Health.
Well, thank you very much, Mr. Speaker, and I'm pleased to rise the third session of the 60th legislation and take the first question from the Green Party. I assume that they are asking about health because they support the throne speech and have no questions on the throne speech. So thank you very much for that. And congratulations to the Premier on having a throne speech that has the support of both opposition parties. Mr. Speaker, it is a serious matter when we come to primary care. And when you look at the fact of the matter is that we have invested significantly in our budget to pay for physicians, pay for nurse practitioners, pay for RNs, do the recruitment to hire more physicians, NPs, RNs. And Mr. Speaker, that number in the budget is again something that we continue to look at. We increased our budget in healthcare to $3.6 billion, which is $344 million more than it was last year. That's a significant increase in healthcare.
Time, Minister. Member for Fredericton-South and Leader of his party.
Monsieur le Président, la ministre de la Santé ne semble pas comprendre à quel point les agents du Nouveau-Brunswick sont mécontents de l'orientation des soins de santé dans la province. Selon un récent sondage de l'Association médicale canadienne, 22% des gens du Nouveau-Brunswick sont insatisfaits de la gestion du système de soins de santé par la province. Il s'agit du taux le plus élevé au Canada. Et ce n'est pas surprenant, Monsieur le Président. Je vais essayer de poser à nouveau la question au ministre de la Santé. Pourquoi ne fournissez-vous pas le financement nécessaire pour que les infirmières praticiennes et les autres professionnels de la santé puissent travailler en équipe avec les médecins afin de garantir aux Néo-Brunswickois un accès cohérent aux services de soins de santé?
The Minister of Health.
Well, thank you very much, Mr. Speaker. I appreciate the question, but I'm trying to fully understand right now what the member opposite is trying to get at, because we have nurse practitioners that are involved in healthcare and providing primary healthcare. They work in clinics. They work alongside doctors. They work in the hospital. Mr. Speaker, and they are a valuable part of the primary healthcare system here in the province of New Brunswick, to the fact that we've actually increased the number of seats of nurse practitioners that will be studying here in the province of New Brunswick. And we've even made it easier for those nurse practitioners to earn and learn at the same time. And with the help of PEDAL and coming up with an innovative way of providing nurse practitioners to continue to work full-time or be paid full-time, plus the RNs can now become NPs, and again, increase their scope of practice that they can provide to the people of the province of New Brunswick.
Thank you, Minister. Member for Fredericton-South and Leader of his party.
Mr. Speaker, the wait times in our emergency rooms continue to be, well, inhumane, while the offload delays for ambulances in Moncton continue to plague the sick and injured. I can't tell you how many times people shared their horror stories of waiting 12, 18, 20 hours in an emergency room, some leaving in frustration, only to get sicker and having to return for another long wait. Neither this government nor the former Liberal government have been able to fix this problem. It's only getting worse. And Mr. Speaker, fundamentally, it's a management problem. And the centralization of management in the regional health authorities is part of this problem. It's been a failure. A practical, concrete solution will be to re-establish local authority over hospital management. Will the Minister of Health return management authority to local hospital administrators so they can work with hospital staff to actually fix problems that plague our hospitals?
Minister of Health.
Well, Mr. Speaker, I also get concerned when I hear people with long wait times at emergency rooms, but here are the facts, Mr. Speaker, that we provided more alternatives for people, whether it's e-visit, whether it's with the HealthLink, whether it's with some of the other clinics that have opened up. So here's the, and actually I could go on and on with respect to some things like the mobile X-ray unit, the paramedics dealing with people at home. But look at the numbers. Average patient offload time last year, August 22nd, at George Dumont was in the 200-minute range. This year, August 2023, around the 50-minute range. Mr. Speaker, the average patient offload time in August of 2022 in Moncton Hospital was 120 minutes. This last August 2022, this year, down to 55 minutes. That's significant improvement, Mr. Speaker, and we're going to continue to work to improve those times, Mr. Speaker, by some of the initiatives.
Thank you, Minister. Time. Member for Fredericton-South and Leader of his party.
Thank you, Mr. Speaker. Our healthcare system is broken. There's no doubt about it. Good doctors and good nurses are leaving their positions because their personal sacrifice to help hold the healthcare system together has been unappreciated, unrecognized, and frankly, they're burnt out. The Premier has said time and time again he's on a mission to save New Brunswick. Well, clearly, he isn't on a mission to save the New Brunswick healthcare system whatsoever. People are waiting too long to see a doctor. They're waiting too long in ambulances, ERs, and hospital hallways as well. Those with cancer are waiting too long for life-saving tests and surgeries, and their cancer spreads. And I've heard heartbreaking stories from cancer patients who have been in exactly that terrifying position. We need concrete, practical solutions, Mr. Speaker, not the kind of Band-Aids the Minister of Health has been referring to. So the question is, when is this minister going to treat the crisis in our healthcare system with the urgency that patients of this province deserve?
Minister of Health.
You know, it's really discouraging the way the Green Party approaches health care. And Mr. Speaker, okay, I'll talk about concrete, practical solutions. Let's talk about the mobile X-ray units that are now available across the province. We had a pilot project that was down at Loch Lomond Villa in St. John, and we had one of these mobile X-ray units. And in the 9-month pilot project, that prevented almost 365 seniors being put into an ambulance and taken to the ER. Mr. Speaker, that diversion, again, there was only 17 seniors that had to go to the ER because they had fractured a wrist or another bone in their body. We've expanded that right across the province of New Brunswick. That is concrete, that is real, that is getting results, Mr. Speaker.